Question 1. Stakeholder feedback indicates a need to reinforce best practices in specimen handling. An RDH has collected a small oral tissue biopsy for histopathological examination. The patient is scheduled for a follow-up appointment in 2 days, and the dental office is experiencing a high volume of patient care. What is the most appropriate course of action for the RDH regarding the biopsy specimen? Option A. Rinse the specimen thoroughly with sterile water to remove any blood and place it in a dry, sterile container for submission to the laboratory tomorrow morning. Option B. Immediately place the specimen in the appropriate fixative solution provided by the laboratory and ensure it is properly labeled with patient and specimen details before arranging for prompt transport to the laboratory. Option C. Store the specimen in a sealed plastic bag at room temperature and submit it along with other lab cases at the end of the week. Option D. Place the specimen in a sterile saline solution and refrigerate it until the patient's follow-up appointment in 2 days, at which point it will be submitted to the laboratory. Correct answer is D. Place the specimen in a sterile saline solution and refrigerate it until the patient's follow-up appointment in 2 days, at which point it will be submitted to the laboratory. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a critical diagnostic specimen where improper handling can lead to misdiagnosis, delayed treatment, and potential harm to the patient. The registered dental hygienist, RDH, is entrusted with a vital step in the diagnostic process, requiring meticulous attention to detail and adherence to established protocols. The challenge lies in balancing the immediate need for specimen collection with the long-term implications of its integrity. Correct approach analysis. The correct approach prioritizes patient safety and diagnostic accuracy by ensuring the specimen is immediately and properly preserved and transported according to established laboratory guidelines. This aligns with the ethical obligation of the RDH to provide competent care and uphold professional standards. Adherence to laboratory protocols for specimen handling, including appropriate fixation, labeling, and timely submission, is crucial for accurate histological examination and subsequent treatment planning. This practice directly supports the integrity of the diagnostic chain, minimizing the risk of errors that could negatively impact patient outcomes. Incorrect approach is analysis. Submitting the specimen without proper fixation or in an inadequate container compromises the cellular structure, rendering it unsuitable for microscopic examination. This is a direct violation of professional standards and can lead to a false negative or inconclusive diagnosis, delaying necessary treatment and potentially causing harm. Demonstrates a failure to follow established protocols for specimen integrity. Delaying submission of the specimen without appropriate preservation can lead to autolyses and bacterial degradation, further compromising its diagnostic value. This negligence in timely submission, coupled with inadequate preservation, constitutes a breach of professional responsibility and can result in a misdiagnosis or the inability to diagnose, impacting patient care negatively. Using a generic container not designed for biological specimens or failing to label it accurately introduces significant risks of misidentification or contamination. This lack of proper identification and containment is a critical failure in specimen handling, potentially leading to the wrong patient's diagnosis or the loss of the specimen altogether, representing a severe ethical and professional lapse. Professional reasoning. Professionals should approach specimen handling with a systematic process. First, identify the specific requirements of the receiving laboratory for fixation, container type, and labeling. Second, ensure all necessary supplies are readily available before commencing the procedure. Third, meticulously follow the established protocol for specimen collection, preservation, and labeling, confirming accuracy at each step. Fourth, arrange for immediate and appropriate transport to the laboratory. Finally, document the entire process in the patient's record. This structured approach minimizes the likelihood of errors and ensures the highest standard of patient care. Question 2. Examination of the data shows a patient presenting with generalized gingival inflammation and probing depths ranging from 4-6 mm. During clinical assessment, the patient reports a subjective feeling of some teeth moving when chewing. The RDH observes slight, but discernible, horizontal movement of several teeth when gentle pressure is applied with an instrument. Considering the need for accurate diagnosis and treatment planning, which of the following assessment approaches best reflects professional standards for evaluating periodontal mobility? Option A. Assuming any reported or observed tooth movement is indicative of advanced periodontal disease and immediately recommending extensive periodontal therapy without further detailed mobility assessment. Option B. Classifying the mobility based on the patient's subjective report of teeth feeling loose without further objective clinical assessment. Option C. Utilizing a standardized classification system to objectively grade the degree of horizontal and vertical tooth movement detected through clinical manipulation, correlating it with probing depths and other periodontal parameters. Option D. Focusing solely on the presence of gingival inflammation and probing depths, disregarding the patient's subjective complaints and any observed tooth movement as potentially unrelated to periodontal status. The correct answer is B. Classifying the mobility based on the patient's subjective report of teeth feeling loose without further objective clinical assessment. Explanation: this scenario is professionally challenging because accurately assessing and classifying periodontal mobility is fundamental to developing an effective treatment plan and predicting prognosis. Misinterpreting mobility can lead to under- or overtreatment, impacting patient outcomes and potentially violating professional standards of care. The registered dental hygienist, RDH, must possess a thorough understanding of the diagnostic criteria and the implications of different mobility grades. The correct approach represents best professional practice because it aligns with the established diagnostic criteria for periodontal mobility as outlined by recognized dental organizations and regulatory bodies governing RDH practice. This systematic assessment, utilizing a standardized classification system, e.g., Miller's Index or similar, ensures objective evaluation and consistent documentation. Adhering to these standards is crucial for effective interprofessional communication, treatment planning, and meeting the legal and ethical obligations of patient care. It allows for accurate tracking of disease progression and response to therapy, which is a cornerstone of evidence-based practice. An incorrect approach that relies solely on subjective patient complaints without objective clinical assessment fails to meet the standard of care. This is a regulatory and ethical failure because it bypasses the required diagnostic process, potentially leading to delayed or inappropriate treatment. Another incorrect approach that overemphasizes minor physiological mobility as pathological is also problematic. This can lead to unnecessary interventions, patient anxiety, and a misallocation of resources, violating the principle of providing only necessary and evidence-based care. Furthermore, failing to document the mobility assessment accurately constitutes a breach of professional record-keeping standards, hindering continuity of care and potentially exposing the practitioner to liability. Professional decision-making in assessing mobility involves a systematic process. 1. Patient history, inquiring about symptoms like looseness or shifting teeth. 2. Visual inspection, observing for obvious signs of displacement. 3. Palpation and manipulation, using instruments e.g., blunt ends of instruments to gently apply force in different directions, buccolingual, mesial distal, vertical to detect movement. 4. Classification, applying a standardized index to grade the degree of mobility observed. 5. Documentation, recording the findings accurately in the patient's chart, including the classification and any contributing factors. This structured approach ensures a comprehensive and objective evaluation, leading to informed treatment decisions. Question 3. Performance analysis shows that a 9-year-old patient presents with several unerupted permanent teeth, significantly beyond the typical eruption timelines. The parent expresses concern about the delay. What is the most appropriate initial step for the registered dental hygienist to take? Option A. Immediately refer the patient to an orthodontist for a comprehensive evaluation and to discuss potential orthodontic interventions. Option B. Conduct a thorough clinical examination. Obtain a detailed patient history including developmental milestones, and order appropriate radiographic imaging to assess the position and development of the unerupted teeth and surrounding structures. Option C. Advise the parent that delayed eruption is common and often resolves on its own, suggesting a wait-and-see approach for at least another year. Option D. Focus on managing any associated gingival inflammation over the unerupted teeth, and reassure the parent that the teeth will eventually erupt. The correct answer is B. Conduct a thorough clinical examination, obtain a detailed patient history including developmental milestones, and order appropriate radiographic imaging to assess the position and development of the unerupted teeth and surrounding structures. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient exhibits delayed tooth eruption, a deviation from typical development. The professional challenge lies in accurately identifying the underlying cause and implementing an appropriate management plan. This requires a thorough understanding of the complex biological mechanisms of tooth eruption and the various factors that can impede it. Misdiagnosis or inappropriate intervention can lead to suboptimal patient outcomes, including malocclusion, impaction, and potential need for more complex orthodontic or surgical treatment later. Careful judgment is required to differentiate between normal variations in eruption timing and pathological conditions. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates clinical observation, radiographic evaluation, and consideration of the patient's overall health and developmental history. This aligns with the principles of evidence-based practice and the ethical obligation to provide patient-centered care. Specifically, understanding the role of the dental follicle, eruptive forces, such as those generated by the dental pulp, periodontal ligament, and bone remodeling, and the influence of local factors like crowding, supernumerary teeth, or odontomas, and systemic factors like hormonal imbalances or genetic syndromes, is crucial. Radiographic imaging is essential for visualizing unerupted teeth, assessing their position, and identifying any pathological entities that might be obstructing eruption. This systematic approach ensures that the diagnosis is accurate and the subsequent treatment plan is tailored to the individual patient's needs, adhering to professional standards of care and the regulatory framework governing registered dental hygienists, which emphasizes comprehensive patient assessment and appropriate referral when necessary. Incorrect approaches analysis. One incorrect approach is to dismiss the delayed eruption as a normal variation without further investigation. This fails to meet the standard of care by potentially overlooking significant underlying pathology. Ethically, it breaches the duty to act in the patient's best interest and could be considered negligence. From a regulatory standpoint, it deviates from the requirement for thorough patient assessment and diagnosis. Another incorrect approach is to immediately recommend aggressive orthodontic intervention without a definitive diagnosis of the cause of delayed eruption. This is premature and potentially unnecessary. It could lead to iatrogenic complications and increased patient burden without addressing the root cause. Regulatory frameworks emphasize conservative and evidence-based treatment, and such an approach would likely be considered outside the scope of appropriate practice without proper diagnostic justification. A third incorrect approach is to focus solely on the symptomatic treatment of potential associated issues, such as gingival inflammation over an unerupted tooth, without investigating the primary cause of the eruption delay. This is a superficial approach that does not address the fundamental problem. It fails to uphold the professional responsibility to diagnose and manage the underlying condition, potentially leading to long-term complications. Professional reasoning. Professionals should approach delayed tooth eruption by first gathering all relevant clinical and radiographic information. This includes a detailed patient history, a thorough oral examination, and appropriate diagnostic imaging, e.g., panoramic radiograph, periapical radiographs. The collected data should then be analyzed to identify potential etiological factors, differentiating between local and systemic influences, as well as normal developmental variations. Based on this comprehensive assessment, a diagnosis can be formulated. If the cause is identified as a pathological obstruction or a condition requiring specialized management, the patient should be referred to an appropriate specialist, e.g., orthodontist, oral surgeon, if the delay is within the spectrum of normal variation or requires conservative management within the RDH scope of practice. An appropriate treatment plan should be developed and communicated to the patient and their guardian. This systematic, evidence-based, and patient-centered approach ensures optimal care and adherence to professional and regulatory standards. Question 4. Benchmark analysis indicates that a patient presents with a chief complaint of intermittent jaw pain, clicking sounds when opening and closing their mouth, and occasional difficulty chewing. The patient reports these symptoms have been present for several months and seem to worsen with stress. As a registered dental hygienist, what is the most appropriate initial course of action? Option A. Advise the patient on specific exercises to strengthen the jaw muscles and recommend over-the-counter pain relievers for symptom management. Option B. Perform a comprehensive periodontal screening and prophylaxis, assuming the symptoms are unrelated to the TMJ and are likely due to muscle tension from other activities. Option C. Attempt to palpate the TMJ and surrounding muscles to identify the source of pain and provide immediate occlusal adjustments to alleviate the clicking. Option D. Document the patient's reported symptoms and refer them to the supervising dentist for further evaluation and diagnosis of potential temporomandibular joint (TMJ) dysfunction. The correct answer is D. Document the patient's reported symptoms and refer them to the supervising dentist for further evaluation and diagnosis of potential temporomandibular joint (TMJ) dysfunction. Explanation: this scenario presents a professional challenge due to the potential for misdiagnosis and inappropriate treatment of a temporomandibular joint (TMJ) disorder, which can manifest with symptoms that overlap with other oral conditions. A registered dental hygienist, RDH, must exercise careful judgment to differentiate TMJ issues from other dental concerns and understand the scope of their practice in managing such conditions. The challenge lies in recognizing the subtle signs and symptoms of TMJ dysfunction and knowing when to refer to a dentist or specialist, rather than attempting to manage it independently. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the established scope of practice for an RDH. By recognizing the limitations of their diagnostic and treatment capabilities for TMJ disorders, the RDH demonstrates an understanding of the regulatory framework that defines their role. This approach aligns with ethical obligations to practice within one's competence and to refer patients when their needs exceed that competence, ensuring the patient receives appropriate care from a qualified professional. This is further supported by the ethical principle of beneficence, acting in the best interest of the patient. An incorrect approach that involves attempting to definitively diagnose and treat a TMJ disorder without proper training or referral would represent a significant regulatory and ethical failure. This could violate the state's Dental Practice Act, which defines the scope of practice for RDHs and may restrict them from diagnosing or treating TMJ disorders. Ethically, it breaches the duty of care and could lead to patient harm if the diagnosis is incorrect or the treatment is ineffective or exacerbates the condition. Another incorrect approach, such as dismissing the patient's reported symptoms as unrelated to the TMJ without further investigation, fails to uphold the ethical standard of thoroughness and could result in delayed or misdiagnosis of a genuine TMJ issue. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the patient's chief complaint and history, including any reported pain, clicking, popping, or limited jaw movement. 2. Perform a comprehensive intraoral and extraoral examination, paying close attention to the TMJ, muscles of mastication and occlusion. 3. Differentiate TMJ symptoms from other potential oral conditions, such as periodontal disease, caries, or myofascial pain of other origins. 4. Recognize the limitations of the RDH scope of practice regarding definitive TMJ diagnosis and treatment. 5. If TMJ dysfunction is suspected, document findings and refer the patient to the supervising dentist or a qualified specialist for further evaluation and management. Question 5. Analysis of a 5-year-old patient's oral examination reveals the presence of all primary teeth, with no visible signs of permanent tooth eruption. The parent expresses concern about the child's baby teeth and asks if they will eventually fall out to make way for real teeth. Which of the following clinical considerations best reflects the RDH's understanding of primary dentition and its significance in this scenario? Option A. Assuming that all teeth present in a child's mouth are permanent and applying adult treatment protocols for any detected decay. Option B. Focusing solely on the presence of cavities and recommending immediate extraction of any decayed primary tooth, regardless of its developmental stage or impact on future occlusion. Option C. Dismissing the parent's concern about permanent teeth, stating that the child still has many years before permanent teeth erupt and that no further assessment is needed. Option D. Recognizing that primary molars are typically exfoliated before the eruption of permanent premolars, and that the presence of primary teeth is essential for guiding permanent tooth eruption and maintaining arch space. The correct answer is D. Recognizing that primary molars are typically exfoliated before the eruption of permanent premolars, and that the presence of primary teeth is essential for guiding permanent tooth eruption and maintaining arch space. Explanation: scenario analysis. This scenario presents a common clinical challenge for a registered dental hygienist, RDH, involving a young patient with primary dentition. The challenge lies in accurately assessing the developmental stage of the dentition, recognizing deviations from typical eruption patterns, and understanding the clinical implications for oral health management. Misinterpretation can lead to inappropriate treatment recommendations, delayed intervention for potential issues, or unnecessary anxiety for the child and parent. The RDH must possess a thorough understanding of primary dentition characteristics and their significance in predicting future oral health. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the child's chronological age, the presence and condition of primary teeth, and the visual cues of permanent tooth development beneath the gums. This includes noting the sequence and timing of primary tooth eruption, which follows a predictable pattern. Recognizing that primary molars are typically exfoliated before the eruption of permanent premolars is crucial. Furthermore, understanding the clinical significance of primary dentition, such as its role in guiding permanent tooth eruption and maintaining arch space, is paramount. This approach aligns with the RDH's ethical and professional responsibility to provide evidence-based care, conduct thorough assessments, and educate patients and guardians. It directly addresses the core competencies expected of an RDH in managing pediatric oral health, adhering to the scope of practice and the standard of care. Incorrect approaches analysis. One incorrect approach would be to solely focus on the presence of cavities without considering the underlying developmental stage of the dentition. This overlooks the unique characteristics of primary teeth, such as their thinner enamel and dentin, which can influence caries progression and treatment planning. It also fails to acknowledge the importance of primary teeth in arch development and the potential for premature loss to cause space loss for permanent teeth. This approach is ethically deficient as it does not provide comprehensive care tailored to the patient's developmental needs. Another incorrect approach would be to assume that any tooth present in a child's mouth is a permanent tooth and apply treatment protocols accordingly. This demonstrates a fundamental lack of understanding of primary dentition differences, including their size, shape, and eruption timeline. Such an approach could lead to incorrect diagnoses, inappropriate restorative or prosthetic interventions, and a failure to recognize early signs of developmental anomalies or orthodontic concerns that are specific to primary dentition. This is a failure to meet the standard of care and could result in harm to the patient. A further incorrect approach would be to dismiss concerns about delayed eruption of permanent teeth simply because the primary teeth are still present. While primary teeth do guide permanent teeth, a significant delay in their exfoliation or the absence of signs of permanent tooth eruption can indicate underlying pathology or developmental issues that require investigation. Ignoring these signs, based solely on the presence of primary teeth, would be a dereliction of the RDH's duty to identify and report potential health concerns. This is an ethical failure to act in the best interest of the patient's long-term oral health. Professional reasoning. Professionals should approach this situation by first establishing a baseline understanding of the patient's age and developmental stage. This involves a thorough clinical examination of the oral cavity, noting the number, type, and condition of teeth present. The RDH should then compare these findings to established eruption charts and developmental milestones for primary dentition. Crucially, the RDH must consider the functional and developmental significance of primary teeth, such as their role in mastication, speech, and maintaining space for permanent teeth. Any deviations from the norm should prompt further investigation and consideration of potential underlying causes or future implications. This systematic, age-appropriate, and developmentally informed approach ensures comprehensive and ethical patient care. Question 6. The audit findings indicate a recurring pattern of incomplete medical and dental history documentation in patient charts, raising concerns about potential risks to patient safety and compliance with professional standards. Which of the following actions best addresses these findings and upholds the principles of safe and ethical dental hygiene practice? Option A. Focus on updating the medical and dental history only when a patient reports a significant change in their health status, rather than at every visit. Option B. Instruct dental assistants to expedite the completion of the medical and dental history form by asking only a few key questions to save time during appointments. Option C. Implement a standardized, comprehensive medical and dental history form that is reviewed and updated at every patient visit, with specific emphasis on questioning patients about current medications, allergies, systemic diseases, and recent health changes, and ensuring this information directly informs the treatment plan. Option D. Rely on the patient's self-reporting during the appointment without a structured form, assuming patients will volunteer all necessary information. The correct answer is C. Implement a standardized, comprehensive medical and dental history form that is reviewed and updated at every patient visit, with specific emphasis on questioning patients about current medications, allergies, systemic diseases, and recent health changes, and ensuring this information directly informs the treatment plan. Explanation: this scenario is professionally challenging because it requires the registered dental hygienist, RDH, to balance the immediate need for patient care with the critical importance of accurate and comprehensive medical and dental history. The audit findings suggest a potential systemic issue in how patient histories are being collected and utilized, which can have significant implications for patient safety and the quality of care provided. Careful judgment is required to identify the root cause of the audit findings and implement corrective actions that are both effective and compliant with regulatory standards. The correct approach represents best professional practice because it directly addresses the identified audit findings by emphasizing the foundational role of a thorough medical and dental history in safe and effective dental hygiene practice. Regulatory frameworks for RDHs, such as those governed by state dental boards in the U.S., mandate that practitioners obtain and maintain accurate patient health histories. This is not merely a procedural step, but a critical component of risk management, enabling the RDH to identify potential contraindications for treatment, recognize systemic conditions that may manifest orally, and tailor treatment plans to individual patient needs. A comprehensive history allows for informed decision-making, preventing adverse events and ensuring that treatment is appropriate and safe. Ethically, it aligns with the principle of beneficence and non-maleficence, ensuring the patient's well-being is prioritized. An incorrect approach that focuses solely on completing the patient chart without a deep understanding of the history's implications is professionally unacceptable. It fails to meet the regulatory requirement for obtaining a meaningful history that informs care. It also violates ethical principles by potentially leading to inappropriate treatment or overlooking critical health issues. Another incorrect approach that prioritizes speed over accuracy in history taking is equally problematic. This directly contravenes the regulatory expectation of diligence and thoroughness in patient assessment. Such an approach increases the risk of misinformation, leading to potential harm to the patient and professional liability for the RDH. Furthermore, it undermines the trust inherent in the patient-provider relationship. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and investigate audit findings thoroughly. 2. Review relevant state dental board regulations and professional practice guidelines concerning medical and dental histories. 3. Assess current protocols for history collection and integration into treatment planning. 4. Identify specific areas of deficiency or noncompliance. 5. Develop and implement targeted educational initiatives for staff on the importance and components of a comprehensive medical and dental history. 6. Reinforce the necessity of using the collected history to inform all aspects of patient care, from diagnosis to treatment planning and execution. 7. Establish a system for regular review and updating of patient histories. 8. Document all actions taken in response to audit findings. Question 7. The efficiency study reveals that a novel topical antimicrobial agent demonstrates significantly enhanced efficacy in reducing periodontal pathogens compared to the currently utilized agent, with a comparable safety profile. Considering the registered dental hygienist's scope of practice and regulatory requirements for antimicrobial use, which of the following actions best reflects adherence to professional standards and patient well-being? Option A. Recommend and implement the novel topical antimicrobial agent for eligible patients, provided it aligns with the patient's overall treatment plan and there are no contraindications identified. Option B. Continue using the currently utilized topical antimicrobial agent for all patients, as established protocols are generally effective and changing agents requires extensive retraining. Option C. Propose the systemic administration of the novel antimicrobial agent to all patients undergoing periodontal therapy based on the study's findings of pathogen reduction. Option D. Advocate for the immediate discontinuation of all topical antimicrobial agents in favor of a new, unproven systemic regimen suggested by a colleague. Correct answer is A. Recommend and implement the novel topical antimicrobial agent for eligible patients, provided it aligns with the patient's overall treatment plan and there are no contraindications identified. Explanation. This scenario presents a professional challenge because it requires the registered dental hygienist, RDH, to critically evaluate the findings of an efficiency study concerning antimicrobial agents and apply this information to patient care within the strict confines of regulatory guidelines. The core of the challenge lies in discerning which antimicrobial agent, based on the study's findings, aligns with current best practices and regulatory mandates for local and systemic use, while also considering patient-specific factors and potential contraindications. The RDH must navigate the potential for new information to influence established protocols, ensuring that any change in practice is evidence-based, safe, and compliant. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based decision-making, aligning with the RDH's ethical and legal obligations. By selecting the agent demonstrated by the study to be most effective and safest for the specific clinical application, local or systemic, the RDH adheres to the principle of providing competent care. This approach is further supported by regulatory frameworks that mandate the use of scientifically validated treatments and require professionals to stay abreast of advancements in their field. The RDH's responsibility extends to understanding the nuances of antimicrobial stewardship, ensuring appropriate use to prevent resistance and optimize therapeutic outcomes. An incorrect approach would involve disregarding the study's findings and continuing with a previously used agent without a valid clinical or regulatory reason. This failure to incorporate evidence-based advancements into practice constitutes a breach of professional competence and may violate regulations requiring the provision of care that meets current standards. Another incorrect approach would be to adopt a new agent solely based on the study's findings without considering individual patient contraindications, allergies, or potential drug interactions. This oversight would violate the ethical principle of do no harm and could lead to adverse patient outcomes, a clear regulatory failure. Furthermore, misinterpreting the study's findings to justify the use of an agent for a purpose not supported by the evidence or regulatory guidelines would also be a significant professional and regulatory lapse. The professional decision-making process for similar situations should involve a systematic evaluation of new evidence, such as efficiency studies. This includes critically appraising the study's methodology, relevance to the RDH's scope of practice, and the specific clinical context. The RDH must then cross-reference these findings with existing regulatory guidelines, professional standards, and patient-specific health histories. This multifaceted approach ensures that any decision regarding the use of antimicrobial agents is not only informed by the latest research, but also grounded in patient safety, ethical considerations, and legal compliance. Question 8. Research into the anatomical variations of the maxillary and mandibular incisors, including their crown morphology, root length, and potential for developmental anomalies, is essential for effective diagnosis and treatment planning. Considering a patient presents with a history of recurrent gingivitis around the mandibular incisors, which of the following approaches best reflects the RDH's professional responsibility in assessing these teeth? Option A. Thoroughly examine the crown and root surfaces of the mandibular incisors, noting any irregularities, concavities, or unusual root morphology that could predispose to plaque accumulation, and correlate these findings with radiographic evidence. Option B. Focus primarily on the visible crown surfaces of the mandibular incisors, ensuring adequate plaque removal and providing general oral hygiene instructions. Option C. Prioritize the assessment of the gingival tissues for inflammation and bleeding, with a cursory examination of the incisor crowns to ensure no gross pathology is evident. Option D. Rely on generalized anatomical charts of incisor morphology to identify potential issues, assuming the patient's anatomy falls within typical parameters. The correct answer is A. Thoroughly examine the crown and root surfaces of the mandibular incisors, noting any irregularities, concavities, or unusual root morphology that could predispose to plaque accumulation, and correlate these findings with radiographic evidence. Explanation. This scenario presents a common clinical challenge for a registered dental hygienist, RDH, involving the assessment of incisor anatomy and its implications for patient care. The challenge lies in accurately identifying subtle anatomical variations that could impact treatment planning, oral hygiene instruction, and the detection of pathology. Careful judgment is required to differentiate normal anatomical variations from signs of disease or developmental anomalies, ensuring patient safety and optimal outcomes. The correct approach represents best professional practice because it directly aligns with the RDH's scope of practice, as defined by insert-specific U.S. State Dental Practice Act, e.g., California Business and Professions Code, Section 3100 et seq., and the American Dental Hygienists Association, ADHA standards of care. These regulations mandate that RDHs perform comprehensive oral health assessments, including the evaluation of tooth morphology and root anatomy, to identify potential oral health issues. Accurate assessment of incisor crown and root anatomy is crucial for effective plaque biofilm removal, appropriate instrumentation selection, and the early detection of conditions like root caries, fractures, or developmental defects. This approach prioritizes evidence-based practice and patient-centered care. An incorrect approach that focuses solely on the visible crown without considering root anatomy would be professionally unacceptable. This failure would violate the regulatory requirement for a comprehensive assessment, potentially leading to misdiagnosis of subgingival calculus, root surface irregularities that harbor bacteria, or underlying root pathology. Ethically, it represents a breach of the duty of care to the patient by providing incomplete diagnostic information. Another incorrect approach that relies on generalized knowledge without considering individual patient variations would also be problematic. While general anatomical principles are important, each patient's dentition is unique. Failing to account for individual variations in root length, curvature, or the presence of accessory canals could lead to ineffective treatment or iatrogenic damage during instrumentation. This would fall short of the professional standard of personalized care. A third incorrect approach that prioritizes speed over thoroughness would be a significant ethical and regulatory failure. The RDH has a professional obligation to conduct a complete and accurate assessment, regardless of time constraints. Rushing through the examination compromises the quality of care and increases the risk of diagnostic errors, which is contrary to the principles of patient safety and professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the patient's medical and dental history. 2. Conduct a comprehensive visual and tactile examination of all tooth surfaces, including the gingival margin and potential subgingival areas. 3. Utilize diagnostic aids such as radiographs and Explorer to assess root anatomy, detect calculus, and identify any abnormalities. 4. Integrate findings with knowledge of normal tooth anatomy and common variations. 5. Formulate a diagnosis and develop a personalized treatment plan, including appropriate oral hygiene instructions tailored to the patient's specific anatomy and oral health status. 6. Document all findings and treatment decisions accurately in the patient's record. Question 9. The evaluation methodology shows that a registered dental hygienist is utilizing digital radiography for routine intraoral examinations. The hygienist has captured a series of periapical images and is now reviewing the processing options available within the imaging software. Considering the advantages of digital radiography in terms of image manipulation and the potential disadvantages of overprocessing, which of the following processing approaches best aligns with professional standards for diagnostic accuracy and patient record integrity? Option A. Utilize aggressive contrast and brightness adjustments to create a highly stylized image that makes all anatomical landmarks appear exceptionally distinct, regardless of potential artifact introduction. Option B. Apply subtle image enhancement filters to optimize contrast and sharpness, ensuring that no pathological features are created or obscured, and that the final image accurately represents the intraoral structures. Option C. Refrain from using any image processing tools, accepting the raw image data as is, even if it results in suboptimal diagnostic clarity due to inherent limitations in exposure or positioning. Option D. Process each image with multiple, significantly different enhancement settings, and save all variations to provide a comprehensive view of potential interpretations. Correct answer is B. Apply subtle image enhancement filters to optimize contrast and sharpness, ensuring that no pathological features are created or obscured, and that the final image accurately represents the intraoral structures. Explanation. Scenario analysis. This scenario presents a common challenge in dental radiography, balancing the benefits of digital imaging with potential drawbacks and ensuring patient safety and diagnostic accuracy. The professional challenge lies in selecting the most appropriate processing technique for digital radiography to optimize image quality, while adhering to established professional standards and regulatory guidelines for radiation exposure and record keeping. The hygienist must critically evaluate the advantages and disadvantages of different processing methods in the context of patient care and legal requirements. Correct approach analysis. The correct approach involves selecting a processing method that enhances diagnostic information without introducing artifacts or compromising the integrity of the radiographic record. This aligns with the fundamental ethical and regulatory obligation to provide competent patient care and maintain accurate records. Specifically, using image enhancement features judiciously to improve contrast or sharpness, while avoiding excessive manipulation that could alter the diagnostic interpretation, represents best professional practice. This approach ensures that the radiographic images are both diagnostically useful and legally defensible, adhering to the principles of ALARA, as low as reasonably achievable, for radiation exposure, and maintaining the fidelity of patient records as mandated by dental practice acts and professional guidelines. Incorrect approach is analysis. One incorrect approach is to solely rely on automatic processing features without critical evaluation. This can lead to over-enhancement, potentially creating artifacts that mimic pathology or obscure true findings, thereby compromising diagnostic accuracy. Ethically, this fails to uphold the standard of care. Legally, it could violate regulations requiring accurate and interpretable patient records. Another incorrect approach is to avoid any image enhancement, even when subtle adjustments could significantly improve diagnostic clarity. While this avoids over-manipulation, it may result in suboptimal images that hinder accurate diagnosis, which is a failure to provide the highest quality of care. This could also be seen as a failure to utilize the full diagnostic potential of the digital imaging system, potentially leading to misdiagnoses. A third incorrect approach is to save multiple versions of the processed image with vastly different enhancement levels. This creates ambiguity regarding which version represents the true diagnostic finding and can complicate record keeping. It raises questions about the integrity of the patient's record and may violate regulations concerning the maintenance of a single, definitive record. Professional reasoning. Professionals should approach digital radiography processing with a systematic decision-making process. First, understand the inherent advantages of digital radiography, such as immediate image acquisition and reduced radiation dose. Second, be aware of the potential disadvantages, including the risk of overprocessing and the need for proper data management. Third, critically evaluate the specific needs of the patient and the diagnostic question being asked. Fourth, judiciously apply image processing tools, focusing on enhancing diagnostic features without introducing artifacts or altering the fundamental information. Fifth, always adhere to institutional policies and regulatory requirements regarding image quality, radiation safety, and record retention. Finally, maintain a clear and concise record of the processing steps taken, if necessary, to ensure transparency and accountability. Question 10. The assessment process reveals a patient presenting for routine prophylaxis requires scaling and root planing in the mandibular posterior quadrant. The RDH notes the patient has a history of trigeminal neuralgia. During the procedure, the patient reports sharp, shooting pain radiating from the posterior mandible, even after local anesthetic administration. Considering the innervation and vascularization of the oral cavity, which of the following actions best reflects a safe and effective professional response? Option A. Immediately cease the procedure, reassess the patient's pain and anesthetic effectiveness, and consult with the dentist regarding alternative pain management strategies or further diagnostic evaluation of the trigeminal nerve pathway in that region. Option B. Increase the depth of scaling to address any potential underlying pathology contributing to the nerve irritation. Despite the patient's reported pain, Option C. Administer a higher concentration of vasoconstrictor in the local anesthetic to attempt to numb the area more effectively, without further assessment of the nerve's specific distribution. Option D. Continue with the scaling and root planing, assuming the patient's pain is a typical response to the procedure, and the anesthetic will eventually take full effect. Correct answer is A. Immediately cease the procedure, reassess the patient's pain and anesthetic effectiveness, and consult with the dentist regarding alternative pain management strategies or further diagnostic evaluation of the trigeminal nerve pathway in that region. Explanation. The scenario presents a common challenge in dental hygiene practice, managing patient discomfort and potential complications during a procedure that involves the intricate vascular and nervous systems of the oral cavity. A registered dental hygienist, RDH, must possess a thorough understanding of the innervation and vascularization of the oral structures to anticipate and respond appropriately to patient responses and potential adverse events. This knowledge is not merely academic. It directly impacts patient safety, comfort, and the efficacy of treatment. The correct approach prioritizes patient well-being and adherence to professional standards by accurately identifying the nerve responsible for sensation in the area of treatment and understanding its proximity to the blood supply. This demonstrates a commitment to safe practice, as outlined by the regulatory framework governing RDHs, which mandates competent practice based on a sound knowledge of oral anatomy and physiology. By recognizing the potential for nerve irritation or damage and the associated vascular considerations, the RDH can modify their technique, provide appropriate anesthesia, and manage patient expectations, thereby minimizing risk and ensuring a positive treatment outcome. This aligns with the ethical obligation to provide care within the scope of practice and to avoid causing harm. An incorrect approach that fails to accurately identify the relevant nerve or its vascular relationships poses significant risks. For instance, if an RDH incorrectly identifies the nerve, they might administer anesthesia ineffectively, leading to inadequate pain control and patient distress. More critically, a lack of understanding of the vascular supply could lead to inadvertent injury to blood vessels, potentially causing hematoma formation, excessive bleeding, or even more serious complications. Such failures would contraindicate adherence to the regulatory standards of care, which require a competent and knowledgeable application of dental hygiene principles. Ethically, it represents a breach of the duty of care owed to the patient, potentially leading to patient harm and professional disciplinary action. The professional decision-making process in such situations involves a systematic approach. First, a thorough review of the patient's medical history and dental status. Second, a precise anatomical assessment of the area to be treated, recalling the specific nerves and blood vessels involved. Third, consideration of the planned procedure and its potential impact on these structures. Fourth, selection of appropriate techniques and materials, including local anesthesia. And finally, continuous patient monitoring and communication throughout the procedure. This systematic approach ensures that all relevant factors are considered, leading to safe, effective, and ethical patient care. Question 11. Which approach would be most consistent with best practices for comprehensive periodontal assessment by a registered dental hygienist? Option A. Systematically probing all sites in a standardized manner, recording probing depths, bleeding on probing, and mucogingival junction location for each tooth. Option B. Probing only the mesiobuccal and distobuccal sites of each tooth and noting any obvious signs of gingival swelling. Option C. Estimating probing depths based on visual cues and patient comfort, focusing primarily on areas that appear inflamed. Option D. Measuring probing depths at selected sites and relying on the dentist's overall assessment for the complete periodontal diagnosis. The correct answer is A. Systematically probing all sites in a standardized manner, recording probing depths, bleeding on probing, and mucogingival junction location for each tooth. Explanation. This scenario is professionally challenging because accurately assessing periodontal health requires precise technique and nuanced interpretation of probing depths, bleeding on probing, and recession. A dental hygienist must not only collect data, but also synthesize it to form a diagnosis and treatment plan, which directly impacts patient outcomes and adherence to scope of practice. The correct approach represents best professional practice because it emphasizes a systematic, standardized technique for probing, ensuring consistency and accuracy in measurements. This aligns with the registered dental hygienist, RDH, scope of practice, which mandates the collection of comprehensive periodontal data to inform diagnosis and treatment. Adherence to established guidelines for probing depth measurement, recording bleeding points, and assessing mucogingival involvement is crucial for identifying the extent and severity of periodontal disease, thereby enabling appropriate intervention and patient education. This meticulous approach supports evidence-based practice and upholds the ethical responsibility to provide competent and safe patient care, as outlined by the regulatory framework governing RDHs. An incorrect approach that relies on subjective estimation rather than precise measurement fails to meet the standard of care. This could lead to underestimation or overestimation of periodontal disease, resulting in delayed or inappropriate treatment, which violates the ethical duty to act in the patient's best interest and potentially contravenes regulatory requirements for accurate patient assessment. Another incorrect approach that neglects to record bleeding on probing or mucogingival status provides an incomplete picture of periodontal health. This omission hinders accurate diagnosis and treatment planning, potentially leading to missed opportunities for early intervention and management of inflammatory or structural periodontal issues, thus failing to meet the comprehensive assessment requirements mandated for RDHs. A third incorrect approach that focuses solely on probing depths without considering other clinical indicators like mobility or furcation involvement presents an incomplete periodontal assessment. This superficial evaluation may not identify all aspects of periodontal disease, leading to a misdiagnosis or inadequate treatment plan, which is a failure to provide the thorough care expected within the RDH scope of practice. Professionals should employ a decision-making framework that prioritizes patient safety and evidence-based practice. This involves consistently applying standardized assessment techniques, critically interpreting all collected data within the context of the patient's overall oral health, and collaborating with the dentist for diagnosis and treatment planning. Continuous professional development and adherence to regulatory guidelines are essential for maintaining competence and ensuring the highest quality of care. Question 12. The review process indicates a need to evaluate the registered dental hygienist's ability to differentiate between the maxillary and mandibular first premolars based on their crown and root anatomy, and to apply this knowledge to clinical considerations. Which of the following comparative analyses best reflects this understanding and its clinical relevance? Option A. Comparing the number of cusps and the typical root configuration. Noting that maxillary first premolars often have 2 cusps and bifurcated roots, while mandibular first premolars usually have 2 cusps and a single, more divergent root. Option B. Describing the general function of premolars in grinding food and their role in the dental arch. Option C. Discussing the typical enamel thickness of all premolars and its implications for fluoride uptake. Option D. Outlining the common eruption sequence of premolars and their relative positions to adjacent teeth. The correct answer is A. Comparing the number of cusps and the typical root configuration, noting that maxillary first premolars often have 2 cusps and bifurcated roots, while mandibular first premolars usually have 2 cusps and a single, more divergent root. Explanation. The review process indicates a need to assess the registered dental hygienist's RDH understanding of premolar anatomy and its clinical implications, particularly when comparing the maxillary and mandibular first premolars. This scenario is professionally challenging because subtle anatomical differences between these teeth can significantly impact diagnosis, treatment planning, and the effectiveness of preventive and therapeutic interventions. A thorough understanding is crucial for accurate charting, appropriate instrumentation selection, and effective patient education regarding oral hygiene. The correct approach represents best professional practice by directly comparing the key anatomical features of the maxillary and mandibular first premolars, focusing on aspects directly relevant to clinical practice. This includes their cusp morphology, root structure, number and divergence, and the presence and configuration of root canals. This comparative analysis allows the RDH to anticipate potential challenges, such as the bifurcated roots of the maxillary first premolar or the often single, more divergent root of the mandibular first premolar, and to tailor their approach accordingly. This aligns with the ethical obligation to provide competent and individualized patient care, as mandated by professional standards and state dental hygiene practice acts, which require the application of knowledge to clinical situations. An incorrect approach would be to focus solely on the general characteristics of premolars, without differentiating between the maxillary and mandibular first premolars. This fails to acknowledge the significant anatomical variations that dictate clinical management. For instance, Overlooking the potential for bifurcated roots in the maxillary first premolar could lead to inadequate debridement or miscalculus in furcation areas, violating the standard of care and potentially leading to periodontal disease progression. Another incorrect approach would be to focus on root canal anatomy without considering the crown morphology and its impact on plaque retention and occlusal function. This would be a failure to consider the tooth holistically in its functional context. Ethically, such an approach demonstrates a lack of thoroughness and attention to detail, potentially compromising patient outcomes and failing to meet the expected standard of care for an RDH. The professional decision-making process for similar situations should involve a systematic evaluation of the specific tooth in question, recalling its detailed anatomical features. This includes considering its position in the arch, its typical morphology, crown and root, and common variations. The RDH should then correlate these anatomical findings with potential clinical implications, such as susceptibility to caries, periodontal disease, or challenges during instrumentation. This analytical process ensures that the RDH can anticipate and address patient-specific needs effectively, adhering to the highest standards of professional practice and ethical responsibility. Question 13. The analysis reveals a patient presenting with multiple areas of suspected enamel demineralization on anterior teeth. Which of the following diagnostic approaches best optimizes the process of identifying the precise location and extent of these lesions for effective treatment planning? Option A. Focusing only on the facial surfaces of the anterior teeth where demineralization is most visually apparent. Option B. Comprehensive visual and tactile examination of all tooth surfaces, utilizing appropriate diagnostic instruments and good lighting to meticulously identify and assess each demineralized area. Option C. Immediately recommending a fluoride varnish application to all anterior teeth without a detailed surface-by-surface examination. Option D. Relying primarily on the patient's subjective report of sensitivity to guide the assessment of demineralized areas. Correct answer is B. A comprehensive visual and tactile examination of all tooth surfaces, utilizing appropriate diagnostic instruments and good lighting to meticulously identify and assess each demineralized area. Explanation. Scenario analysis. A dental hygienist is presented with a patient exhibiting signs of early-stage enamel demineralization on multiple anterior teeth. Challenge lies in accurately identifying the specific tooth surfaces affected and the extent of demineralization to formulate an effective, evidence-based treatment plan. Misdiagnosis or incomplete assessment can lead to inappropriate interventions, potentially causing harm or failing to address the underlying issue, impacting patient oral health outcomes and adherence to professional standards. Correct approach analysis. The correct approach involves a systematic visual and tactile examination of all tooth surfaces, utilizing appropriate diagnostic tools such as a dental explorer and good lighting. This method allows for precise identification of demineralized areas, differentiating them from other surface irregularities. This aligns with the registered dental hygienist (RDH) scope of practice, emphasizing thorough patient assessment as the foundation for all treatment. Adherence to established diagnostic protocols ensures that treatment is tailored to the individual patient's needs, promoting optimal oral health and preventing further disease progression, which is a core ethical and regulatory responsibility. Incorrect approaches analysis. One incorrect approach is to rely solely on patient self-reporting of sensitivity without a comprehensive clinical examination. This fails to meet the regulatory requirement for a thorough patient assessment and can lead to misdiagnoses or misinterpretations of the condition. Ethically, it breaches the duty of care by not performing due diligence. Another incorrect approach is to immediately recommend aggressive restorative treatment without first confirming the diagnosis and assessing the reversibility of the demineralization. This bypasses the critical diagnostic phase, potentially leading to unnecessary and irreversible interventions, violating the principle of do no harm, and exceeding the scope of practice if restorative treatment is not within the RDH's purview without dentist prescription. A third incorrect approach is to focus only on the visually obvious lesions and neglect less apparent areas, such as interproximal surfaces or lingual aspects. This incomplete examination compromises the accuracy of the diagnosis and treatment planning, failing to provide comprehensive care as expected of a licensed professional. It neglects the regulatory expectation of a complete and thorough assessment. Professional reasoning. Professionals should approach such situations by first recalling and applying the established diagnostic protocols for identifying and assessing enamel demineralization. This involves a systematic head-to-toe examination of the oral cavity, utilizing all available diagnostic aids. The decision-making process should prioritize accurate diagnosis over immediate intervention, ensuring that any proposed treatment is evidence-based, appropriate for the stage of the disease, and within the RDH's scope of practice. Ethical considerations, such as patient autonomy and beneficence, guide the selection of the least invasive yet most effective treatment. Question 14. Benchmark analysis indicates that a registered dental hygienist, RDH, is assessing a patient presenting with a history of recurrent interproximal caries. During the examination, the RDH notes that several of the patient's posterior teeth exhibit unusually deep occlusal pits and fissures, as well as pronounced cuspal inclines. Considering the patient's caries history, which of the following approaches best integrates tooth morphology into a comprehensive risk assessment for preventive strategies? Option A. Documenting the presence of deep pits and fissures and pronounced cuspal inclines as normal anatomical variations without further consideration, as these are common findings. Option B. Evaluating how the depth and morphology of the pits and fissures, in conjunction with the patient's caries history and other risk factors, may predispose them to increased plaque retention and bacterial colonization, thereby informing targeted preventive recommendations. Option C. Recommending immediate placement of sealants on all occlusal surfaces of the posterior teeth, irrespective of the patient's current oral hygiene status or other risk factors. Option D. Focusing primarily on the aesthetic appearance of the cuspal inclines and suggesting elective cosmetic modifications to improve the tooth's surface smoothness. Correct answer is A. Documenting the presence of deep pits and fissures and pronounced cuspal inclines as normal anatomical variations without further consideration, as these are common findings. Explanation. This scenario is professionally challenging because it requires the registered dental hygienist, RDH, to integrate knowledge of tooth morphology with a risk assessment framework to identify potential issues that could impact oral health. The challenge lies in moving beyond simple identification of tooth features to understanding how those features might predispose a patient to specific problems, thereby informing preventive strategies and treatment planning. Careful judgment is required to differentiate between normal anatomical variations and morphological characteristics that represent a genuine risk factor. The correct approach represents best professional practice because it directly applies the RDH's understanding of tooth morphology to a patient's specific risk factors by considering how a particular tooth's shape, size, or surface features might contribute to plaque accumulation, susceptibility to caries, or periodontal disease. The RDH can tailor preventive advice and interventions. This aligns with the ethical and regulatory obligation of the RDH to provide individualized patient care based on a comprehensive assessment, which includes understanding anatomical predispositions. This proactive approach aims to prevent disease rather than merely treat it, embodying the principles of public health and preventive dentistry mandated by regulatory bodies. An incorrect approach that focuses solely on identifying common morphological variations without linking them to patient risk fails to meet the standard of care. This is a regulatory failure because it neglects the diagnostic and assessment responsibilities of the RDH, potentially leading to missed opportunities for early intervention and disease prevention. Ethically, it is a failure to provide comprehensive care. Another incorrect approach that prioritizes cosmetic considerations over functional or health-related morphological implications is also professionally unacceptable. This represents a regulatory failure as it deviates from the primary mandate of promoting oral health and preventing disease. Ethically, it prioritizes superficial concerns over the patient's well-being and could lead to unnecessary or inappropriate interventions. The professional decision-making process for similar situations involves a systematic approach. 1. Patient history and chief complaint. Understand the patient's overall oral health status and any concerns. 2. Clinical examination. Conduct a thorough visual and tactile examination of the oral cavity, including detailed assessment of tooth morphology. 3. Risk assessment. Evaluate factors that increase the likelihood of oral disease, such as diet, oral hygiene habits, systemic health, and genetic predispositions. 4. Integration of findings. Correlate observed tooth morphology with identified risk factors. For example, deep pits and fissures might be considered a higher caries risk in a patient with a high-sugar diet. Prominent cervical enamel projections might be linked to increased plaque retention and periodontal issues. 5. Treatment planning and patient education. Develop a personalized plan that addresses identified risks, incorporating specific preventive strategies informed by the morphological assessment. Educate the patient on how their tooth anatomy might influence their oral health and how to manage it effectively. Question 15. Stakeholder feedback indicates that some registered dental hygienists are experiencing challenges when patients express significant anxiety regarding dental radiography. In one instance, a patient became visibly distressed when informed that X-rays were necessary for a comprehensive examination, expressing fears about radiation exposure. The hygienist is concerned about proceeding with the imaging while also wanting to ensure the patient feels comfortable and safe. What is the most appropriate course of action for the registered dental hygienist in this situation, adhering strictly to the principles of radiation safety and professional practice? Option A. Proceed with the X-ray immediately without additional shielding or proper collimation to quickly complete the procedure and reduce the patient's immediate distress. Option B. Cancel the radiographic procedure entirely due to the patient's anxiety, opting for a visual examination only, even if it means potentially missing diagnostic information. Option C. Explain the necessity of the radiograph for diagnosis, detail the safety measures being employed, lead apron, thyroid collar, collimation, appropriate exposure settings, and offer reassurance and time for questions to alleviate the patient's anxiety before proceeding. Option D. Increase the exposure settings significantly to ensure a rapid image acquisition, thereby minimizing the time the patient is in the operatory and reducing their anxiety. The correct answer is C. Explain the necessity of the radiograph for diagnosis, detail the safety measures being employed, lead apron, thyroid collar, collimation, appropriate exposure settings, and offer reassurance and time for questions to alleviate the patient's anxiety before proceeding. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing the need for diagnostic imaging with the ethical and regulatory imperative to minimize radiation exposure to both the patient and the dental hygienist. The patient's anxiety introduces an emotional element that can complicate objective decision-making, potentially leading to a deviation from established safety protocols. The dental hygienist must navigate the patient's concerns while upholding their professional responsibility to adhere to radiation safety principles. Correct approach analysis. The correct approach prioritizes patient and operator safety by adhering to the ALARA as low as reasonably achievable principle. This involves using appropriate collimation, lead shielding, and ensuring proper exposure settings. It also includes clear communication with the patient to alleviate anxiety and explain the necessity and safety measures of the radiographic procedure. This aligns with the fundamental principles of radiation protection mandated by regulatory bodies governing dental radiography, which emphasize minimizing dose without compromising diagnostic quality. The RDH's role includes patient education and ensuring all safety protocols are followed. Incorrect approaches analysis. One incorrect approach involves proceeding with the X-ray without adequate shielding or proper collimation due to the patient's distress. This directly violates the ALARA principle and regulatory requirements for radiation protection, exposing both the patient and the operator to unnecessary radiation. It demonstrates a failure to uphold professional responsibility and a lack of adherence to established safety standards. Another incorrect approach is to cancel the necessary radiographic procedure entirely solely based on the patient's anxiety, without attempting to mitigate their concerns or explore alternative solutions. While patient comfort is important, abandoning a diagnostically indicated procedure without exploring all reasonable safety measures and communication strategies can compromise patient care and is not in line with the professional's duty to provide comprehensive dental hygiene services within safe parameters. A third incorrect approach is to perform the X-ray with excessive exposure settings to get it done quickly, to appease the anxious patient. This is a direct contravention of the ALARA principle, as it intentionally increases radiation dose beyond what is necessary for diagnostic purposes, thereby increasing risk without a corresponding benefit. This demonstrates a severe disregard for radiation safety regulations and ethical practice. Professional reasoning. When faced with a situation involving patient anxiety and the need for radiographic imaging, a dental hygienist should employ a structured decision-making process. First, acknowledge and validate the patient's concerns. Second, clearly explain the purpose of the radiograph, the benefits it provides for diagnosis and treatment planning, and the specific safety measures being implemented, e.g., lead apron, thyroid collar, collimation, proper exposure factors. Third, offer reassurance and allow the patient to ask questions. If anxiety persists, explore options such as a brief break or a different positioning for the sensor. The decision to proceed with radiography must always be guided by the ALARA principle, ensuring that the diagnostic benefit outweighs the minimal risk of radiation exposure and that all protective measures are employed. Question 16. During the evaluation of a patient presenting with generalized moderate gingivitis and localized areas of deeper probing depths, 5-6 mm, with bleeding on probing, which of the following treatment approaches best aligns with the registered dental hygienist's scope of practice for non-surgical periodontal therapy? Option A. Perform scaling and root planing only in the areas with deeper probing depths, and leave the remaining areas for a routine prophylaxis at the next appointment. Option B. Perform scaling and root planing to remove calculus and plaque biofilm from the root surfaces, followed by thorough polishing of the entire dentition. Option C. Conduct a routine prophylaxis cleaning to remove supragingival plaque and stain, and advise the patient on oral hygiene techniques. Option D. Focus solely on polishing the teeth to remove superficial stains and provide patient education, deferring any scaling to a subsequent appointment. Correct answer is B. Perform scaling and root planing to remove calculus and plaque biofilm from the root surfaces, followed by thorough polishing of the entire dentition. Explanation. This scenario presents a common challenge in non-surgical periodontal therapy, balancing thoroughness with patient comfort and the need for effective treatment. The professional must accurately assess the extent of calculus and inflammation to determine the appropriate therapeutic intervention. The correct approach involves a comprehensive assessment of the periodontal tissues, including probing depths, bleeding on probing, and visual identification of calculus deposits. Based on this assessment, scaling and root planing, SRP, is indicated to remove the etiologic factors contributing to periodontal disease. Following SRP, thorough polishing is essential to remove any remaining plaque and superficial stains, creating a smooth root surface that is less conducive to plaque accumulation and easier for the patient to maintain. This aligns with the registered dental hygienist's scope of practice as defined by Insert Specific States Dental Practice Act or relevant regulatory bodies' guidelines, e.g., the California Dental Board's regulations for RDHs. Ethical practice dictates providing the highest standard of care, which includes addressing the underlying disease process and promoting oral health. An incorrect approach would be to perform only a prophylaxis cleaning without adequate assessment and without addressing the deeper calculus deposits. This fails to treat the underlying periodontal disease, potentially leading to its progression and negative health outcomes for the patient. This would violate the professional's duty to diagnose and treat periodontal conditions within their scope of practice, as outlined in Insert Specific States Dental Practice Act or relevant regulatory bodies' guidelines. Another incorrect approach would be to perform SRP but neglect thorough polishing, leaving the root surfaces rough and potentially increasing plaque retention. This would also fall short of best practice and could be considered a failure to provide complete and effective treatment, potentially violating Insert Specific States Dental Practice Act or relevant regulatory bodies' guidelines regarding the standard of care. Professionals should approach such situations by first conducting a thorough periodontal assessment. This assessment guides the treatment plan. If signs of periodontitis are present, SRP is indicated. The decision-making process should prioritize patient well-being and evidence-based practice, ensuring all necessary therapeutic interventions are provided within the RDH's scope of practice and in accordance with regulatory requirements. Question 17. The efficiency study reveals a pattern of advanced incisal and occlusal wear on the canines of a significant patient cohort, impacting their functional guidance during mastication. As an RDH, what is the most appropriate initial clinical action to address this finding? Option A. Perform a detailed assessment of the canine crown and root anatomy, Evaluate the extent of wear and associated dentin exposure, and initiate patient education regarding potential etiologies and preventive strategies. Option B. Focus solely on scaling and root planing for any associated periodontal concerns, deferring discussion of wear to a future appointment. Option C. Advise the patient to avoid all acidic foods and beverages without a comprehensive assessment of the wear's cause. Option D. Recommend immediate fabrication of a full coverage occlusal splint to protect the canines from further wear. The correct answer is A. Perform a detailed assessment of the canine crown and root anatomy, evaluate the extent of wear and associated dentin exposure, and initiate patient education regarding potential etiologies and preventive strategies. Explanation: the efficiency study reveals a recurring challenge in the dental hygiene clinic. A significant number of patients present with advanced wear on their canines, impacting their occlusal function and potentially leading to further oral health complications. This scenario is professionally challenging because it requires the registered dental hygienist, RDH, to not only identify the problem, but also to understand the underlying causes and implement appropriate interventions within their scope of practice, considering the complex crown and root anatomy of canines and their crucial role in mastication and guiding mandibular movement. The correct approach involves a comprehensive assessment of the canine's crown and root anatomy, including evaluating the extent of wear, assessing the underlying dentin exposure, and examining the supporting periodontal structures. This assessment informs the RDH's ability to educate the patient on the etiology of the wear, e.g., bruxism, abrasive diet, erosion, and to recommend appropriate preventive and therapeutic strategies. This aligns with the RDH's responsibility to provide patient-centered care, promote oral health, and prevent disease progression, as outlined in the regulatory framework for RDHs, which emphasizes thorough patient assessment and evidence-based interventions. The RDH's role in identifying and managing early signs of occlusal disharmony and wear is critical for maintaining overall oral health and function. An incorrect approach would be to solely focus on superficial cleaning or to dismiss the wear as a minor cosmetic issue. This fails to address the root cause of the canine wear, potentially allowing the condition to worsen and lead to more severe problems such as temporomandibular joint dysfunction, further tooth loss, or increased sensitivity. Such an approach would violate the ethical obligation to provide comprehensive care and could be considered a breach of professional standards if it leads to adverse patient outcomes. Another incorrect approach would be to recommend irreversible restorative procedures without a thorough assessment and consultation with a dentist, as this exceeds the RDH's scope of practice and could compromise patient care. The regulatory framework for RDHs clearly defines the boundaries of their practice, and exceeding these boundaries without proper referral or collaboration is a significant professional and ethical failure. Professional decision-making in such situations requires a systematic process. First, conduct a thorough clinical examination of the canines, including visual inspection, palpation, and potentially radiographic assessment if indicated. Second, gather patient history, inquiring about habits, diet, and any symptoms experienced. Third, analyze the findings in relation to the known anatomy and function of canines. Fourth, develop a patient-specific treatment plan that may include patient education, fluoride application, occlusal guards, or referral to a dentist for further evaluation and restorative treatment. This process ensures that interventions are appropriate, evidence-based, and within the RDH's scope of practice, prioritizing patient well-being and adherence to regulatory guidelines. Question 18. The monitoring system demonstrates radiographic evidence of interproximal bone loss in several posterior quadrants, with some areas exhibiting a distinct vertical component. Additionally, subtle radiopacities are noted along the root surfaces of some teeth, suggestive of calculus deposits. The patient's chart indicates a history of moderate periodontal disease. Considering these findings, what is the most appropriate next step for the registered dental hygienist? Option A. Focus solely on removing the radiographically identified calculus deposits and disregard the bone loss patterns as potentially age-related changes. Option B. Correlate the radiographic findings with clinical measurements of probing depths, bleeding on probing, and gingival recession to assess the current periodontal status and guide treatment. Option C. Document the radiographic findings as definitive evidence of current disease activity and schedule a routine prophylaxis without further clinical assessment. Option D. Recommend immediate surgical intervention based solely on the observed vertical bone loss, assuming advanced periodontal destruction. Correct answer is B. Correlate the radiographic findings with clinical measurements of probing depths, bleeding on probing, and gingival recession to assess the current periodontal status and guide treatment. Explanation. This scenario presents a professional challenge because it requires the registered dental hygienist, RDH, to accurately interpret radiographic findings of bone loss and calculus, which are critical indicators of periodontal disease progression. The challenge lies in distinguishing between early signs, established disease, and potential artifact, necessitating a thorough understanding of radiographic anatomy and pathology. Furthermore, the RDH must integrate these findings with clinical data to formulate an appropriate treatment plan, adhering to established standards of care and regulatory guidelines for patient management. The correct approach represents best professional practice because it involves a systematic and evidence-based evaluation. This includes correlating radiographic findings with clinical examination data, such as probing depths, bleeding on probing, and gingival recession. This integrated approach ensures a comprehensive assessment of the patient's periodontal status, leading to accurate diagnosis and appropriate treatment planning. Regulatory frameworks for RDHs emphasize the importance of thorough patient assessment, accurate record keeping, and the provision of evidence-based care. By meticulously documenting radiographic findings and their correlation with clinical signs, the RDH upholds professional responsibility and adheres to the standard of care expected within the jurisdiction. An incorrect approach that relies solely on radiographic interpretation without clinical correlation is professionally unacceptable. This failure constitutes a violation of the standard of care, as radiographic evidence alone can be misleading. For instance, radiographic bone loss can be influenced by the angle of the radiograph or the presence of anatomical landmarks, and may not always reflect the true extent of periodontal destruction. Failing to consider clinical signs like pocket depths or bleeding on probing can lead to under- or overtreatment, compromising patient outcomes and potentially violating ethical principles of beneficence and non-maleficence. Another incorrect approach might involve misinterpreting calculus deposits, mistaking them for other radiopacities, which could lead to an incomplete or inaccurate diagnosis of the patient's oral hygiene status and the need for scaling. This demonstrates a lack of diagnostic acumen and a failure to meet the professional competency requirements for an RDH. The professional decision-making process for similar situations should involve a hierarchical approach. First, a thorough review of the radiographic images, identifying any signs of bone loss, its pattern e.g., horizontal, vertical, and the presence of calculus. Second, a comprehensive clinical examination, including probing, visual inspection, and assessment of gingival health. Third, the integration of radiographic and clinical findings to establish a diagnosis and treatment plan. Finally, clear and accurate documentation of all findings and the rationale for the treatment plan, ensuring compliance with all relevant state dental board regulations and ethical guidelines. Question 19. Regulatory review indicates that a dental hygiene clinic is experiencing a high patient volume, leading to increased pressure to process instruments quickly between appointments. A dental hygienist is preparing to reprocess a set of critical instruments used in a surgical procedure. Which of the following actions best aligns with regulatory requirements for equipment and instrument disinfection and sterilization? Option A. Wiping down the instruments with an intermediate-level disinfectant wipe to remove visible debris before the next patient. Option B. Sterilizing the instruments in an autoclave after a brief manual scrubbing to remove gross contamination. Option C. Rinsing the instruments under running water and then placing them in an ultrasonic cleaner for a short cycle before air drying. Option D. Thoroughly cleaning the instruments and then immersing them in an EPA-registered high-level disinfectant solution for the manufacturer's recommended contact time, followed by rinsing and drying. Correct answer is D. Thoroughly cleaning the instruments and then immersing them in an EPA-registered high-level disinfectant solution for the manufacturer's recommended contact time, followed by rinsing and drying. Explanation. The scenario presents a common challenge in dental hygiene practice, ensuring the highest standard of infection control when faced with time constraints and potential equipment limitations. The professional challenge lies in balancing efficiency with the absolute necessity of patient safety, which is paramount in preventing the transmission of infectious agents. Careful judgment is required to select the most appropriate and legally compliant method of instrument reprocessing. The correct approach represents best professional practice because it adheres strictly to established guidelines for high-level disinfection or sterilization, as mandated by regulatory bodies governing registered dental hygienists. This ensures that all microorganisms, including resilient spores, are eliminated or inactivated, thereby protecting patients and the dental team from potential harm. Following manufacturer instructions for equipment and chemical agents is also a critical component of regulatory compliance and effective practice. An incorrect approach that bypasses or inadequately performs the required disinfection or sterilization process constitutes a significant regulatory and ethical failure. This failure directly violates the duty of care owed to patients and breaches the standards set by the regulatory board. Such actions increase the risk of cross-contamination and potential transmission of serious infections, leading to disciplinary action, loss of license, and potential legal liability. Inadequate cleaning, for instance, can render sterilization ineffective, as debris can shield microorganisms. Using expired or improperly mixed chemical disinfectants compromises their efficacy, failing to meet the required microbial kill claims. Relying solely on surface disinfection for instruments that require sterilization is a critical error, as surface disinfectants are not designed to eliminate all pathogenic microorganisms, particularly spores. Professionals should employ a decision-making framework that prioritizes patient safety and regulatory compliance. This framework involves 1. Identifying the type of instrument and its intended use to determine the required level of processing, cleaning, disinfection, or sterilization. 2. Consulting and strictly adhering to the manufacturer's instructions for all equipment and chemical agents used in the reprocessing cycle. 3. Verifying the efficacy of the chosen reprocessing method through appropriate monitoring, e.g., biological indicators for sterilization. 4. Documenting all reprocessing procedures as required by regulations. 5. Remaining current with evolving guidelines and best practices in infection control. Question 20. Risk assessment procedures indicate that a patient with a history of moderate chronic periodontitis, who has demonstrated excellent home care compliance and is currently periodontally stable, is being considered for their routine periodontal maintenance appointment. Which of the following approaches best reflects current regulatory guidelines and best professional practice for determining the next recall interval? Option A. Schedule the next recall appointment at a 4-month interval to ensure close monitoring and early detection of any potential recurrence. Option B. Determine the recall interval based on a comprehensive reevaluation of the patient's current periodontal status, home care effectiveness, and risk factors, potentially adjusting from the previous interval. Option C. Recommend a 12-month recall interval, as the patient's excellent home care and current stability suggest a low risk of immediate relapse. Option D. Schedule the next recall appointment at the standard 6-month interval, as this is the generally accepted frequency for periodontal maintenance. The correct answer is A. Schedule the next recall appointment at a 4-month interval to ensure close monitoring and early detection of any potential recurrence. Explanation. This scenario presents a common professional challenge in dental hygiene, determining the appropriate recall interval for a patient with a history of periodontal disease. The challenge lies in balancing the need for ongoing monitoring and intervention to prevent disease recurrence with the patient's individual risk factors and the practicalities of scheduling. A thorough risk assessment, incorporating the patient's current periodontal status, home care compliance, and systemic health, is paramount. The correct approach represents best professional practice because it aligns with the fundamental principles of periodontal maintenance therapy, as outlined by regulatory bodies governing registered dental hygienists. This approach emphasizes individualized care, where recall intervals are not standardized, but are determined by a comprehensive assessment of the patient's risk of disease progression or recurrence. This aligns with the ethical obligation to provide care that is tailored to the patient's specific needs and promotes optimal oral health outcomes. Regulatory guidelines for RDHs typically mandate that treatment plans, including recall intervals, be based on a thorough clinical evaluation and patient-specific factors, rather than a one-size-fits-all model. An incorrect approach that relies solely on a fixed recall interval such as always scheduling a 6-month recall regardless of the patient's current condition, fails to acknowledge the dynamic nature of periodontal health. This can lead to either overtreatment for low-risk patients or undertreatment for high-risk patients, both of which are professionally unacceptable and potentially violate regulatory mandates for evidence-based and individualized care. Another incorrect approach might be to defer to the patient's preference for a longer interval without a robust clinical justification, which compromises the RDH's professional judgment and responsibility to manage periodontal disease effectively. This disregards the RDH's duty to provide the most appropriate care based on their expertise and the patient's clinical presentation, potentially leading to disease exacerbation and negative health consequences. The professional decision-making process for similar situations should begin with a comprehensive periodontal assessment, including probing depths, bleeding on probing, recession, furcation involvement, and radiographic evaluation. This assessment must be integrated with the patient's medical history, oral hygiene practices, and any other relevant risk factors. Based on this holistic evaluation, the RDH, in collaboration with the dentist, should determine a personalized recall interval that allows for timely detection of any signs of disease activity and facilitates appropriate intervention. This iterative process of assessment, treatment planning, and reevaluation is the cornerstone of effective periodontal maintenance.